coronavirus. How, and when, might the COVID-19 lockdown end? It's the question everyone wants answered. How, and when will the lockdown end? And what comes next? A number of reporters have asked the question, and a number of experts have given their best estimates, but at the moment, they are just that, estimates. The measures are due to be reviewed for the first time next week. But Cabinet Office Minister Michael Gove said on Saturday, there is no fixed point, no specific date in the calendar at which we can say things will change. Dr. Jenny Harries, Deputy Chief Medical Officer, said last week that lockdown measures would need 3 weeks for review and 2 or 3 months to see if we've really squashed it. 3 to 6 months, ideally. However, she added that there was lots of uncertainty. She said, this is not to say we would be in complete lockdown for 6 months, but as a nation we have to be really responsible and keep doing what we're all doing until we're sure we can gradually start lifting various interventions which are likely to be spaced, based on the science and our data, until we gradually come back to a normal way of living. So, how would the lockdown end? One scientist advising the government said, the lockdown is only buying time and we need a clear exit strategy from the COVID-19 crisis. Professor Graham Medley told The Times, this disease is so nasty that we had to suppress it completely. Then we've kind of painted ourselves into a corner, because then the question will be, what do we do now? We will have done 3 weeks of this lockdown, so there's a big decision coming up on the 13th of April. In broad terms, are we going to continue to harm children to protect vulnerable people, or not? It will take months or even years for life to return to the way it was before, and there are concerns that we could be caught in a cycle of lockdowns until a vaccine and/or a cure are discovered. Would the United Kingdom's borders need to be more strictly policed? There's little point in getting the virus under control in the United Kingdom if it can still be brought in by people traveling from countries where it is not yet under control. Currently, there is no testing at airports. Arrivals are simply told to go straight home, and then to obey the same rules as the rest of the United Kingdom. There has been a suggestion that those who survived the virus could be tested and issued with immunity certificates, allowing them to return to work. These could be especially useful for healthcare workers, but they also raise questions. Will people be encouraged to expose themselves to the virus, so they can get back to normal life? What about people who are at high risk of complications or death from the virus? Until now, they have been told to be much more strict about isolating themselves. Would they then face a choice between having to remain isolated indefinitely, or having to risk their lives in catching the virus, so they can return to work and have the ability to travel? Stephen Powys, National Medical Director of NHS England, said, the illness is still being studied, adding, it is very likely that this virus will become established in populations throughout the world, and so we need a strategy to manage this over time, not just in the next few weeks, or the next few months. As we learn more about it, as the scientific evidence builds, that will allow those strategies to evolve.